I'm not taking them away from anybody.
Secretary,
you want me to indicate a product for which there is no clinical data?
Senator,
is that what you want?
Secretary Kennedy, you said you wouldn't, and now you did.
I'm not taking them away. Everybody can get access to them.
No, they can't walk into a pharmacy the way they could last month and get access.
It depends on the state. It depends on the states.
A year ago,
but they can still get it. Everybody can get it. Everybody can get it, Senator.
So look, let's move on. You clearly are taking away vaccines. I've seen the list for what's coming up next, and that is the agenda for the next CDC vaccine panel. And first up is ratifying your COVID actions. Second is hepatitis B is on the agenda. So should Americans expect you to take away hepatitis vaccine access as well, even though you promised not to?
As I said, I'm not taking vaccines away from anybody.
Okay, same answer, right? You're just going to deny that when people can't get access, that you're not taking it away. Then let me ask you, is that the same game you're going to play with me?
You want me to recommend every product in the world? No, so that without any clinical trial data.
Through on your promises.
Yeah, my promise was to give.
A month ago, we could get COVID vaccines by just walking.
You can still get COVID vaccines, Senator.
You are taking that away.
No, you are still. You can still get the COVID vaccines, and Medicare will still pay for them, and Medicaid will still pay for them.
Tell the head of the CDC that if she refused to sign off on your changes to the childhood vaccine schedule, that she had to resign.
No, I told her that she had to resign because I asked her, are you a trustworthy person? And she said no. So if you had an employee who told you they weren't trustworthy, would you ask them to resign, Senator?
So I'm sorry, but this is not what she has said publicly. She has said.
I'm not surprised about that.
So you're saying she's lying?
Yes. Every conversation I had with her, there were witnesses.
Let me get this straight. This is the same person that less than a month earlier, you stood next to her and described her as unimpeachable, and you had full confidence in her, and that you had full confidence in her scientific credentials. And in a month, she became a liar?
Yeah, you should ask her what changed. And by the way, a month ago, you were voting against her. Oh, because you thought she was either incompetent, ineligible, or unsuited to the task.
I voted against her because I was afraid she was going to bend the knee to you and Donald Trump. And it looks like she didn't bend the knee, so you fired her. Look, you're putting America's babies' health at risk, America's seniors' health at risk, all Americans' health at risk, and you should resign.
Senator Sanders.
Just want to pick up on Senator Warren's point. Are you telling us that the former head of CDC went to you, you asked her, are you a trustworthy person? And she said, no, I am not a trustworthy person?
She didn't say, no, I'm not a trustworthy person. She said, no.
Wow.
Giving a quote.
And I asked her, no, 1 second. And you're also repeating now that she is a liar, correct? Which you wrote in the Wall Street Journal.
If she wrote that I fired her because she refused to sign on in advance for the ACIP committee, no, that's not accurate.
All right, so you're calling her a liar, and I look forward to her coming before the Health Committee, maybe this committee as well. All right, Mr. Secretary, I've got a bunch of questions. Appreciate brevity in answering it. So-called beautiful bill threw 15 million Americans off of health care, substantially raised premiums, and is going to have a terrible impact on nursing homes, community health centers, rural hospitals all over America. Very briefly, is that really making America healthy again?
It's going to have it's going to be the biggest infusion of federal dollars into rural health care in American history.
Yeah, you know why? Because you're cutting $150 billion for rural hospitals. You're putting $50 billion back. That's not an infusion. That's a loss of $100 billion. All right, next question. President Trump, who I don't usually agree with, called COVID vaccines, quote, one of the greatest miracles in the history of modern day medicine that saved tens of millions of lives worldwide. Scientific community agrees with Trump. Lancet study found that it prevented almost 20 million deaths during their first year of use. Secretary Kennedy, are President Trump and the medical community right, or do you still believe that the COVID vaccine was, quote, the deadliest vaccine ever made?
No, first of all, I didn't say that. Oh, I said that in terms of affairs reports a while ago. I said today, I think that President Trump should get the Nobel Prize.
So who's right? Is Trump in the medical community right, or are you right?
President Trump did an extraordinary piece of leadership.
Is he right or wrong? Did COVID save millions of lives?
As I said, he got Americans back to work. At that time, that particular vaccine, which perfectly matched the virus that was circulating then, and I have no idea how many lives it saved, but it saved quite a few.
You know, what I find a little bit weird in this discussion, I'm hearing it over and over again this morning, Mr. Chairman, is we've got the entire medical community on one side. You got the AMA representing hundreds of thousands of doctors, the American Academy of Pediatrics, the American Public Health Association. All of these organizations are telling us that COVID vaccine and vaccines in general are safe and effective. You are casting doubt on that. Who are your who are the organizations that are agreeing with you in casting aspersions on vaccines?
The primary advisors are Marty McCary, Jay Bhattacharya, Dr. Oz, Vinay Prasad.
So you got a few doctors who agree with you, and I'm giving you the
Not a few doctors. What you're talking about is there's a big difference, Senator, between established science and the scientific establishment, which has been co-opted by the pharmaceutical industry.
Hold on. So you're telling the American people that the American Medical Association, representing hundreds of thousands of people, have been co-opted and that they should not trust their doctors.
And
the American Academy of Pediatrics, and by the way, just for the record, every single Republican, I don't mean to be political here, Mr. Chairman, has received PAC money from the pharmaceutical industry. Are they all corrupt as well?
And I'm telling you, the American Heart Association has been co-opted by the food
Everybody
industry.
but you, Senator. But you know what? When you ran for president, you know, we have a corrupt campaign finance system. Maybe you'll agree with me on that. Okay, you were already president, you had $1.5 billion behind it. You received $300,000 from people, not from the industry, people in it, as I did, from individuals. You corrupt. President Trump got $3 million. Every Republican got corporate PAC money for the pharmaceutical industry. Democrats as well. Everybody is corrupt, but you? Is that what we're looking at? I don't think so. And I think the issue now...
I don't even know what you're talking about.
Well, I think you do know what I'm talking about.
I don't know what you're talking about.
The issue is every time anyone disagrees with you...
Are you saying the pharmaceutical industry was supporting my presidential campaign?
No, I'm saying...
I don't think so.
I'm not saying that. I'm saying that the pharmaceutical industry is a greedy institution which is charging us the highest prices in the world. They are pervasive. But to suggest that every institution, the AMA, the pediatrics people, is corrupt because they disagree with you is an insult to the American people.
Listen, people disagree with me all the time. I have arguments in my agency, heated arguments every day with Jay Bhattacharya, with Marty McCary, with Dr. Oz.
You have given the names of a few people. I have given you the names of organizations representing hundreds of thousands of doctors and scientists. I yield, Mr. President.
Senator Tillis.
Thank you, Mr. Chair. Secretary Kennedy, thank you for being here. A couple of times you asked people if they were making a statement or a